Okay, hello. So today we are delighted to be joined by Francesca Fiennes from King's Hospital from the Breast Cancer Screening Unit. Francesca, thank you so much for joining us today. As we know, October is Breast Cancer Awareness Month, so we wanted to do a quick online workshop just to help raise breast cancer awareness and screening and signs to look out for. So I am going to leave it there. And Francesca, take it away and thanks for joining.
Great, thank you so much for having me, and hi to everyone online. I'll just start sharing my screen. So like Ellen said, I work in breast cancer screening. So I am based in Kings, which is in Southeast London. So I cover the boroughs of Bexley, Bromley, Lambeth, Lewisham, Southwark, and Greenwich. But a lot of the information today applies to the national screening program, and also possibly if there is anyone who's by chance watching in Ireland, it'll be very similar. So across the EU we do offer things, and Europe we obviously offer screening. It's slightly different depending on where you are. So yeah, this will be kind of mostly UK based information. So I guess if we're not a webinar or if it's not an interactive session, you can have a think about this yourself. It's really important to think that some of us will have different definitions of what being healthy means. So for some people that might be feeling physically healthy, some people might be feeling mentally healthy. Sometimes we often think, oh, I'm either sick or unwell or I'm completely healthy. But when we look at things like screening or vaccinations or early diagnosis tests, sometimes you won't necessarily feel sick. So that's something that's important to think about in relation to your health. And we're going to show this new campaign we have at the end of the session before we have questions. So what is breast cancer? So like Ellen said, this month is Breast Cancer Awareness Month, which obviously when you work in breast screening is every month of the year. But we really want to use October as a time to promote breast awareness regardless of your age, and also promote breast screening and information about health promotion to reduce your risk factors for breast cancer. So breast cancer, unfortunately, is the most common cancer that impacts women, or people assigned female at birth. And obviously, that would also include trans women as well, if they've been taking hormones for more than 5 years. But breast cancer can also impact people born as men and men. So a lot less common, but it can happen. So there's about 56,000 cases in women per year and about 400 in men. So the signs and symptoms will be very similar. So when you're talking to people, hopefully after today, and you're thinking, I want to share some information around checking your breast or your chest, the symptoms are very similar. So breast cancer originates in breast tissue, and it's when cells multiply and form tumors, and the severity of that cancer depends on the stage. So the earlier the stage, the less severe the cancer, and the later stage, the more severe the cancer. Breast cancer over the last 20 years, the treatment has become a lot better. So that means that a lot of people, even if they do get diagnosed, they will likely survive the cancer. So sometimes people are hesitant to look after their health or come to screening because they think, oh, if I have cancer, that's it. There's nothing that can be done. But that's actually really not the case. So particularly with screening, we're trying to pick up cancers at an earlier stage so that we can give people better treatment, and obviously long term, so that those people can have a higher chance of surviving. And breast cancer, in its most common form, it starts in the ducts, so the milk ducts that lead to the nipple. So it's really important to check your breasts or your chest, however you refer to yourself, every month. So if somebody is still having periods, they should do that after their period. And the reason why is because on your period, your breasts can be a bit more lumpy, which means that it can feel like you're feeling a sign or a symptom of breast cancer. But that can just be typical hormonal changes. So we recommend touching after your period, but also if you do notice any changes, see if they do persist after your period as well. So Breast Cancer Now are one of the main charities that do breast cancer awareness information. So this is from their website. But the acronym that we tend to use in the UK is touch, look, check. So touch your breasts and see if you can feel anything. Look for changes as well. So it's not just recommended to check your breasts, but also to look at them, which I know can feel a bit awkward for some people, but it is very important, especially under bright lighting as well. So don't just do it kind of at night and look in the mirror. Try and do it in daylight or in a bathroom that has a bright light so that you can see any changes. You want to check all parts of your breast. You want to go all the way up to your collarbone, up to the armpit, and obviously all over the breast as well. And it doesn't matter if you have bigger breasts or smaller breasts, or you just refer to that area as your chest area, and you might not have much tissue there, but it's really just important that you check them regularly. So it's all about knowing what's normal for you. So for example, some people may have one breast that's bigger than the other normally. If it's normally like that, that wouldn't necessarily be a cause for concern. But if it's become different over time, that's really when you want to go to your GP. And please just go to your GP if you have any concerns at all about your breasts or your chest. It doesn't have to be you think there's something very significant going on, just any different change, please go to your GP. So these are the typical changes that people might notice if they do have a cancer. Obviously, keeping in mind, particularly some lumps, it might be a cyst, it might be something non-cancerous. So if you do notice a sign, try not to panic, try to just go to your GP as soon as you can, and then they can take it from there. If they think that there's something that they want to check out further, they tend to send you to assessment, where you might have a mammogram, which is also part of screening, or same technology as we use in screening, but they might be slightly different processes depending on your age. So you may be able to feel a lump in the breast, but you might not be able to see it. So that's another important one, that doesn't have to be on the surface of the breast. So you might be checking your breast. And we recommend you do so in a sort of kneading motion. So pressing down quite deeply into the breast and try and use your whole hand, go all around your breast, rather than just poking the tissue or just going like this or just tapping. So you really want to be pressing in quite deep to the breast so that you can have a feel. The lump, if somebody has a cancerous lump, it might be harder and it might not move. Whereas if somebody has a cyst, it might move around. But of course, only a clinician or a GP can be certain clinically what something is. So even if you feel something and you think it's moving around, or it feels, I found it in a different place, or it doesn't feel very hard, please still go to the GP, because obviously there are occasional cases where something might feel like a cyst, but it could be cancerous. So either way, please just, you'll hear me say it a lot, please go to the GP if you notice anything. Another sign or a symptom can be a change in the look and feel of the skin. So if any part of the skin starts to look or feel a bit like orange peel. So some people may refer to that as skin dimpling, but just be any change. So that's why it's really important to look at your breast when you're checking as well. A change in the appearance or direction of a nipple can also be a sign or a symptom. Again, if one of your nipples tends to be like that anyway, not necessarily a cause of concern. So that's why it's really important to know your normal. And any discharge, any liquid, particularly if that's clear liquid from one or both of your nipples. Now, if someone is breastfeeding, obviously that could seem like milk, could seem like discharge. If you're ever unsure, please just go to the GP. And also any redness or rash on the skin or around the nipple can also be a sign or a symptom. If somebody has darker skin, it might come up as a darker patch of skin rather than a red rash, for example. So that's also important to note. So what increases the risk of breast cancer? So we do know that people can get breast cancer at a younger age, and unfortunately we are seeing that increase, and that can particularly occur amongst Black women or South Asian women. But we also have seen overall an increase in the number of cases of breast cancer. So it used to be that 1 in 8 were at risk of breast cancer, and now for women or people assigned female at birth, but now it's 1 in 7. Possibly that increase is mostly due to lifestyle, which I'm going to talk about in a few moments as well. but age mostly increases the risk. So that's why we start screening from 50, because we find about 80% in breast cancers in people over 50. So we do encourage anyone at any age, whether they, as long as that person's like, I guess, gone through puberty. So if anyone's 14 plus, and they can check their breast, and right, ideally up until the end of somebody's life as well. It's always important to have a look out, particularly because the earlier we find a cancer, the sooner we can treat it, and the better the prognosis after, particularly with breast cancer, but also cancers like prostate cancer can be detected early, and the treatment can be, those are some of the most treatable cancers. Genetics as well. So family history can play some role, but it only accounts for about 10% of overall cases. So that means that some people might happen to have breast cancer in their family but not have a specific gene. But if you do have 2 or more close family members who've had breast cancer, if there are any cases of ovarian cancer as well, and any of those people are under the age of 40, they can request a risk assessment referral from their GP. So this is the email for most of Southeast London. But if somebody is anywhere in the UK, they can go to their GP and ask for a family risk assessment, family history risk assessment. Sometimes the only time you're asked about your family history of breast cancer is if you're going for hormonal medication like contraception. So if you think that that's possible for you, please make sure you also go to your GP. Now that moves us on to lifestyle. So one of the biggest factors, unfortunately, is drinking alcohol. So that's actually more so than smoking. So if somebody does drink alcohol, the recommendation is to try and limit that to about 14 units a week. So that's about roughly a bottle and a half of wine, or about 5 pints per week, which actually isn't that much alcohol. So that's one of the things that people can do if they are conscious about their risk factors for breast cancer, is cut down what they are drinking. And also being overweight or having a non-active lifestyle. I just want to caveat that by saying that BMI is based on white male athletes, so it's not necessarily applicable to a lot of women, but it is important to think overall about your lifestyle. So for example, if people are quite active, or they're eating like a balanced diet of whole foods and minimal red meat or minimal processed food, it's quite likely that person would then lose weight if they switch to that kind of lifestyle. So you don't have to do it overnight, and there's certainly nothing to say, some people might be overweight or have an obese BMI but actually be quite healthy. But losing weight, particularly as people are older, that can reduce their risk of breast cancer as well. So having an active lifestyle is also important. So it's not just about being of a healthier weight or drinking less alcohol, but it's also combined with being active. So if you aren't active, a nice way to try and start including that is doing a bit more steps per day. So you might maybe get off a bus stop before your house, or meet up with friends and socialize by going for a walk, and then you might kind of increase that through time. So quite a lot of gyms will do discounts if you're over 60, or maybe if you just come off peak, it might be slightly cheaper, which can be quite good over the winter, obviously, as it gets darker and colder. Not everyone will want to exercise outside, and they might also have exercise classes with personal trainers who can teach you how to do certain exercises. So that can be quite a nice way for people to get into it. But ideally, we recommend in the NHS about 2.5 hours of exercise per week. So that would ideally be exercise where you find it slightly hard to talk, so you can't necessarily have the pace of conversation as normal, so you might be a bit out of breath. So that would include strenuous walking or hiking. But yeah, just trying to increase that can reduce your risk of breast cancer. And also, hormonal medication can slightly increase your risk. So if you're taking contraception, you have a slightly increased risk as you're taking it. But obviously, you're taking contraception generally at an age where you're not as at risk of breast cancer. So you might have a higher risk if you're taking it, but most people won't be taking they won't be taking hormonal medication around the age they start breast screening. So most people might stop hormonal medication around their 40s or 50s, so they tend not to coincide. But HRT, so hormone replacement therapy, which can be used to manage the symptoms of menopause, that can have slightly higher increased risk factors for breast cancer. Still pretty low per 1,000 people, but if you're taking it over 5 years, and if you're taking certain types of HRT, that can increase your risk. So if you are on HRT, you can always check in with your GP, and also just make sure that you're being extra cautious when you're, checking your breasts. So that takes us to breast screening. So who has breast screening? So this is for all women or people assigned female at birth who are aged 50 to 71. So this is for everyone, and that's because we know that most people are at risk at that age. And you're meant to be invited every 3 years. There have been some discrepancies over the pandemic. So for example, if you think, I think I definitely had one before COVID or during COVID, but you think you may be overdue, in London, you can call us on this number, which ends in 2024. That's if you want to check if you've been screened recently, if you are you know that you've missed your last one, or you know that you ignored the invite and you would like to self-refer. You can also call us. And also if you're over 71. Different areas in London will have a different areas in the country, will have a different number. So you can Google your local area and type in breast screening centre or breast screening unit, and you should be able to find a number if you also think that you haven't been invited, or you haven't been screened recently, or you missed your appointment for whatever reason. So having why come to breast screening? So breast screening, like I said earlier, is designed to diagnose cancer earlier. So it's basically a test to check if your breasts are healthy, and we can find changes inside the breast that are too small to see or feel. So even if you are checking your breasts regularly, we may be able to detect cancers in screening before you see or feel them. So that's a massive benefit of screening, and it means that we can find cancers at an earlier stage, like stage 1. But some of those small changes can grow and become cancer, or are already cancer. So that's what we do when we're using a mammogram machine, which uses these essentially plastic plates to compress the breast, or squash the breast, as some people say. People may find it slightly uncomfortable, possibly painful, but the test is very short. So they take 4 images, and that generally doesn't last more than a minute. I would say some people might find it painful, but a lot of people don't find it painful at all. So try and keep an open mind if you've never been. And yeah, just keep in mind, like with cervical screening, some people say it's really uncomfortable. Some people say they don't particularly feel it. And obviously the outcome is useful for anyone, that they would know if they do or don't have anything that needs to be sorted out. So you have to keep still, and they take 2 images per breast, one top to bottom, one side to side. You do have to remove your clothes and sometimes long jewelry or necklaces, but only women work in the unit, so you don't necessarily have to feel worried that you're gonna bump into a man, if that's something that would put some people off. And also if you come for further assessment, there may be some men who work there, but generally it's mostly women as well. So positives, like I said, we can detect cancer early, and it also means that people have an increased range of treatment options, and also they're more likely to have less invasive treatment as well. Obviously, increased survival and also quality of life. And overall, we save about 1,300 lives per year with breast screening. So that's really high. So that means we're actually diagnosing I think it's around 18,000, 19,000 in the UK per year through screening. So that means we can diagnose like a very big chunk of cancers early. And obviously it's free, and will be reassuring with a negative result. Like I said, some people may find them uncomfortable, and occasionally people might be overdiagnosed with cancer, which happens if someone's treated for a cancer that otherwise wouldn't affect them. But as I'm sure you can imagine, it's actually quite hard for doctors to be able to tell this cancer will definitely affect someone, this one won't. So most people will feel quite grateful either way, if they are having treatment for cancers in those cases. But that's a very low amount of cases. There is radiation in a mammogram, which has a low risk with cancer. That does increase over time. That's also why we space out mammograms every 3 years, and also why the machine does compress the breast to also try and reduce the dose. But that's still a low risk. Obviously, unfortunately, no screening tests will be perfect. So some cancers may occasionally be missed. Obviously, they can occur between mammograms, but mostly we'll be able to diagnose cancers early through screening. Although some people might find they are a bit anxious or worried about coming back for assessment. But most staff who are working in screening, obviously I haven't met every single radiographer, but everyone's generally in the NHS really friendly and welcoming, and they do this all day. So a lot of our staff are just mammographers and just work in screening or assessment centres. So they're really, really skilled, very friendly, and you'll hear from some of our local staff in our video at the end. This would be the case across the whole of the UK, but we can make adjustments to your appointment. So sometimes people say, I actually didn't come because that screening site's a bit far for me, or actually would rather go somewhere else, or I'd rather come at a different time. So you can actually, when you get your letter, we'll have the London number or the Manchester number, or number in Northern Ireland, or whatever it is, but you can move the time of your appointment. So you might say, I'd rather come at 8:50 because then I can get to work for 9:30 or 10. Or you might say, actually, I'd be happy to be seen at 4:30. I don't want to be seen at 11, 12, or whatever the specific appointment time is. So you can change that. And depending on where you're going, particularly if you're really anxious and you think, I'll go if someone can come with me, but I don't want to go alone, then please bring someone with you. But keep in mind, they might not be able to come into the waiting room with you if it's a mobile site. So some of our sites have a few seats, some of them it's kind of one in, one out, but it might, you could wait in the car for someone or wait outside. And if someone has any language needs, learning disability, physical disability, any severe mental health issues, or any neurodivergent people, they can book a longer appointment as well. So they can pick, normally it's a double slot appointment, so it'd be maybe 15 minutes rather than 6 to 8 minutes. So like I said, you can give us a call if you want us to make adjustments for you. And with the results, you'll get your letter about 2 to 3 weeks after you've been for your breast screening. Only about 1% of people get diagnosed through screening. So most people are coming as a health check. About 5% of people will be called back for further testing, but that doesn't necessarily mean that person has cancer. It might mean that they want to take some more images. It could mean that they can see something that's possibly a cyst, or it looks like something cancerous, but on further testing it's not. But most people will have that normal result and will come back in 3 years. So that's all of the content I have today. I'll go back, or maybe I'll stop sharing, and then Ellen can share our new YouTube campaign. So I worked on that it's been quite a long time now, 10 months or so. We did the filming earlier in the summer, and this was with 12 people overall, but 6 local people, some of whom have been diagnosed with breast cancer through screening, who wanted to share their stories. And we wanted to make a newer, a bit more uplifting resource to empower and encourage people to come to their breast screening. So we can hopefully all have a watch of that now. I actually can't hear it. Maybe it's just me.
My name is Lindsay.
My name is Joyce.
My name is Philomena.
Yes, I'm Joy.
My name's Amira.
Hi, my name's Jennifer.
I'm not relaxed enough.
I'm a Southwark resident. I'm also a mammographer. I worked at King's for many years, and I'm also a breast cancer survivor.
You know when you're 15, you get that letter to go. I got the letter. I got the next letter. I work in health inequality. I couldn't really not go. I had to show example.
There are several reasons why people should come to breast screening. First and foremost, early detection saves lives and it is completely free.
It is a bit uncomfortable, but it's for a few seconds.
It found my cancer, so it's actually life-saving for me.
I found it just straightforward, efficient, in, out, brilliant.
If I hadn't had all my treatment, I don't think I would be talking to you today. So it changes all your priorities. It makes me anyway, feel very lucky to be alive.
Family actually got me through the whole process, and I had some amazing friends who were also there to support.
Breast screening has been really good for me. I've gone every time I've had an appointment. I've never missed one. And the staff are so highly skilled. Radiography is something you study for many, many years. And the staff are friendly, they're kind, and they just do a brilliant job. I wouldn't have found my cancer if it hadn't been for them.
Unfortunately, we can't stop ladies developing breast cancer. Our aim is to detect cancer early so that treatment is less invasive. That's our hope. Just like my mum, she was diagnosed 3 years ago and she's now living her best life. They caught it early and treatment was less invasive.
I'm part of a multidisciplinary team. When you ladies are looking at their breasts, they may not know that they have got anything going on, but when they come for breast screening, we were able to detect small cancers, which if it's detected on time, the chances of survival is higher.
Can't get this message over more strongly. Please, please come into the breast screening. Don't be afraid.
Breast screening saves lives.
Great, thank you for sharing that. If you would like to hear a bit more about all of those stories, and particularly that there were further video edits of each of the people who were speaking in the video, you can go to the King's College Hospital YouTube web pages where there should be all of them, so you get to hear a bit more from each person and some different content as well.
Francesca, thank you so much. I certainly learned so much in that presentation. So yeah, I really appreciate you sharing that. I actually didn't realize that an appointment is only 6 to 8 minutes. Like that's just so short. And as you say, the positives outweigh the negatives. So even if it is a few seconds of being uncomfortable, it's most definitely worth going to that appointment when you're called.
Yeah, definitely. I think sometimes, obviously, if you can, there may be, if you're coming on a busy day or a busy time, obviously there might be a little bit of a wait before your appointment, but the whole appointment, you kind of come in, take your clothes off, you'll talk to the staff, you can change in a private room as well, and then they'll take those 4 images. Yeah, so it's pretty quick in and out. So we want to encourage people to put it on the top of their to-do list. Actually, across most of the UK, there are some areas that meet the NHS target, but actually we kind of need to encourage people everywhere to come to their mammogram and to kind of see the importance of screening. So yeah, we hope that obviously sessions like today or videos and promotion of screening and maybe dispelling some of those myths could really help. Obviously means we could be diagnosing more cancer, so obviously that's
Absolutely. And having a phone number you can call to and self-refer is brilliant too. I actually was at one of these events a few years ago, and there was a lady who was in the session, and that's why I think it was so important that you really focused on checking your breast, because that was something that was told to us in that presentation, and that evening she went home and actually ended up finding a lump. So I just think it shows the importance of having these discussions and having these awareness sessions.
yeah,
It
definitely.
really does.
I think, sometimes we think, oh, if I had something I'd feel it or I'd notice it, but you'd be surprised, particularly if you like I said earlier, not all lumps are visible.
Yeah.
So unless you're actually having a feel, you might miss something. So yeah, it's really good. If you're having your period, that's quite a good time to remember after, so like the day after you finished. But some people might remember there's like a day or a number of like a date that you'll remember, like the 1st of the month or the 30th, or like the same day as your birthday or something. That's just a good time to or if you, I don't know, pay your rent the same day every month, that's a good time to kind of couple it with something else that you know that you're doing, so that you remember to do it. And there's a lot of charities out there that also support younger people. So there's Copperfield, and they do a lot of the resources around encouraging breast awareness in younger people. So obviously breast cancer is less common when you're younger, but obviously it can be related to family history, and sometimes we see more aggressive forms of cancer in people younger. So that's why it's also really important, any age, to check. Yeah.
And then with people who are after menopause, wouldn't matter as much about the time and month when they check.
Yeah, it would be less, it's only because your breast can be a bit more sensitive on your period, or
Yeah.
you can have what we call lumpier breasts on your period. Some people also might naturally have lumpier breasts, which can just mean that the tissue means that your breasts feel a bit lumpier. So that's why it's also really important to attend screening.
Yeah.
So that, because obviously some people, they might not be able to feel everything with their hands. So going to screening means we can see right into the breast.
Yeah, absolutely. Thank you for that. Okay, I have a few questions that if you wouldn't mind answering them first. Francesca, I feel like you've probably answered a lot of these in the presentation, but no harm to go over them again. So what are the early signs of breast cancer that we should be aware of?
Yeah, so like I said at the beginning, it would be any changes to the breast that aren't normal for you. So any change in shape or size, any discharge from nipples, any lumps or thickening, so part of the breast feeling a bit different or harder, skin dimpling, your nipple changes shape or direction, any rash, redness, changing color of the skin. So that's why we recommend not just checking your breast, but also looking in the mirror as well. So just getting comfortable physically doing that so that you can see yourself as well.
Thank you for that. That's another thing I actually wasn't aware of, that actually there'd be physical signs, so it's good to know.
Yeah.
At what age should individuals start getting mammograms, and how frequently?
Yeah, so we offer screening in the NHS as part of like routine screening. So that means that that's for everyone between 50 and 53. So your first invite will come up until your 53rd birthday. But if you haven't got it, please give us a call or go to your GP. It might be different in other countries. Some countries will have mammograms slightly younger or more frequently. In the NHS, there has been an age extension trial, which might see it lower to 47 and extended to 73. But we're still waiting on the results for that. Obviously, if people go privately, they might have mammograms younger. They tend not to be offered to people under 40 as type of screening, because if you're younger, your breast tissue tends to be denser, which means it's harder to see on an X-ray. So what we recommend in the NHS is attending screening when you're invited, but always being breast aware. If you do notice a sign or a symptom, you should go to your GP, and they might be able to refer you, or they should refer you, to a hospital if that's needed, where you might have a mammogram there. If you ever feel you go to the GP and you think, oh, I feel like something's different, but my GP thinks it's fine, you can always seek another opinion at your GP if you feel that you are really concerned about something. But yeah, we don't have it younger just because it wouldn't necessarily be necessary to give to everyone, and there obviously could be risks from radiation as well. So yeah, 50.
Okay. Thank you for that. What lifestyle changes can help reduce the risk of breast cancer?
Yeah, so if you're kind of starting at, I guess, square one, I would say trying to increase your physical activity. So find something that you really, really like. If your friend loves running, but you hate running, pick something else. Like you might enjoy cycling or swimming, or like a dance class or a Zumba. It's something that gets your heart pumping is really good for you. I personally really like kickboxing. So that's my kind of chosen intense workout, which I do every week. Trying to just walk around a bit more. It's a really nice way to socialize, especially when to get a cup of tea, go for a walk with someone. If you have any mobility issues, a lot of leisure centers and gyms will have like chair Pilates or chair yoga, stuff like that. So if you're doing nothing, even like a bit of yoga or Pilates, even if it's at home, start with 10 minutes and work your way up. We do recommend about 2.5 hours a week. But obviously, especially if you're caring for people or you're at home a lot, I would definitely go to YouTube. And yeah, just trying to increase the amount of fruit and vegetables you eat can really help with reducing, maybe if people are eating, like for example, carbohydrates aren't bad for you, but you might have seen the Eat Well plate before. So it's just having like a balanced plate of food, and making sure that you're getting, think if you're exercising a lot as well, your body might need more protein. So you might want to eat like oily fish or eggs if you do eat, tofu, pulses, trying to stay away from like processed food basically in terms of your diet and what you're eating. So processed food would be, if you go to the supermarket and you're reading like back of, I know crisps are great, but if you're reading the back of like a Walker's pack, you're not gonna see many ingredients you'd have in your kitchen. So that's quite a good rule of thumb. Obviously, some of that food that's less processed can be more expensive. So be realistic with what's kind of doable for you. But I guess, yeah, cooking your food at home is a good way of avoiding processed food. And if you do enjoy takeaway, things like that, just trying to reduce that, have that maybe a bit less of a common occasion. And then, yeah, if you do smoke, try and seek help to stop smoking. Obviously, drinking as well, try and keep that below 14 units. So those are kind of good places to start. No one's perfect. Some of us might find it a bit harder to do some of those things than others, which is completely fine. But trying to incorporate it, if you do some already, maybe do another gym session a week to get yourself up to that 2.5 hours, or go for a big long walk on the weekend, something like that.
Absolutely. Yeah, thank you. The small changes, I suppose, can make a big difference. So, as you said, thank you for that. How does family history impact breast cancer risk, and should those with a history get screened earlier?
Yeah, so if someone has a family history, so there's 2 types of genes that impact breast cancer, which are BRCA genes. I'm not a family history specialist myself, but I do know that if you have a family history, you'll be referred to a family history clinic where you will be seen younger. So there's a range of different options. People might be offered more screening and younger, which might be not necessarily a mammogram, depending on someone's age. You might be offered like things like medication, could be things like surgery. It really depends on the person, and what type of, how many family members, and if those people survived, if those people didn't survive. So it really depends. But if you at all suspect you might have a family history, please go to your GP. You might not. For example, my grandma and her sister had breast cancer, but I don't have the gene. So it can just happen in statistically, but always good to double check so that you're kind of taking that step for your health.
Right, thank you for that. What is the role of genetic testing in assessing breast cancer risk, and who should consider it?
Yeah, I guess similar to the first one, but the role basically would be that we can determine, ideally, before maybe somebody does get breast cancer, who has a family history or not. So it's really significant because it means that we could reduce somebody. See, if you have a sign or a symptom, that tends to be a later stage of cancer. So it means that, for example, there are some medications that can drastically reduce people's risk. Obviously, being monitored more if you're at like a much higher risk of getting breast cancer. So if people have the gene, they might be at like a 70% plus risk of getting breast cancer. That's obviously pretty life-changing. And I would just say ask around your family if you don't know. Sometimes, unfortunately, people pass away and we don't know why. So if there is any way that you can find out, without obviously maybe, I don't know, prying too much, but it's always really useful to know so that you can go to your GP. If you're over 50 and you're in the screening program, it might be clinically relevant, but because you're going to be screened more often, you might not need to worry so much. So particularly if you're under 50 and you're not in routine screening and you think you have that history, please go to your GP.
That's amazing, Francesca. That was all the questions. Thank you so much, Francesca. Thanks for joining us today. It was great to hear your presentation, and just thanks for everything you do with raising awareness around breast cancer and screening. And I think the main message today is, if you're called for screening, please go to your appointment. It's worth the few minutes of discomfort. Definitely outweighs, or the positives definitely outweigh the risks or the negatives.
Yeah, and if you're younger as well, please make sure that you do that regularly as well. And encourage your friends, your family. Like, we all need to check up on each other sometimes and make sure we all know how to do it as well, particularly using your whole hand, going all the way up to the collarbone and in the armpit as well. And just knowing, like, if anything is different, just go to your GP. Don't delay.
Brilliant. Thank you so much.
Great, thank you so much.
Okay, we'll leave it there. Bye.
Bye, thank you.